So I'm from a family with a lineage from my father that has a genetic condition called, or a gene called polycystic kidney disease. And I knew about this as a young man because my father had it, and he did various things to care for himself, and was a very successful businessman with a large shopping mall, development company. He was very involved in politics, went into government, served as the General Services Administrator under Jimmy Carter. We were liberal Jews in the South. My family grew up in politics. I got very involved, along with the whole family, in Jimmy Carter's campaign, primarily inspired by the need for Carter to provide an alternative and block the vehement racism of George Wallace. For those of you who don't remember that time, Wallace had been getting quite a lot of votes as an independent presidential candidate and also was a threat in the Democratic primaries. In any case, as a young man, I got involved and saw what could happen when someone goes from 0% in the polls to winning the office of the presidency. About that time, I was diagnosed with this condition. It took until my early 20s to find out. When I was diagnosed, part of the message was, you will either die soon or you might live a long time, and there's very little you can do about it. Well, the one thing I did do about it was to think about what I wanted to do with my life. And it did help clarify a number of things, and I just will evoke, as Ambassador Lewis has touched on, the larger spectrum of all the issues, and any of us who've been awake during our lifetimes have certainly come to the conclusion that the planet is on a very difficult and dangerous course. And I concluded that I should use the power and privilege that I had as a white North American male from an affluent family to use those tools, the power of business and finance and politics, towards the common good. And that if I did that, however many days I got to live, I'd be doing what I would feel good about on my deathbed when I looked back, if I had that opportunity. So I chose to move my career to Canada because of a great opportunity to work with a visionary inheritor of a substantial amount of resources named Carol Newell. And we put together a strategy that Dr. Ross really got me thinking about here, which was to take a long-term look at how to deploy financial resources towards systemic social change focused in one region. So we make business investments, charitable grants, support collaborations, leadership development and capacity building with the hopes of influencing public policy and creating models of sustainability solutions long term. If you live in Vancouver, BC, you can't help but notice what it means to be in one of the wealthiest and most blessed places on the planet. And if you can't do it in places like that and in places like here, we have a real problem on our hands. So that's my work. I went along working a bazillion hours like most of you do, and knowing that death would come someday, as all of you do. And then in December, well, I've lost the date. In 2005, I was told that I was at 30%. Let's see, let me get this right. 2006, I was told that my kidney function had dropped to 30%. Well, I was still, people told me any symptom I felt was just aging. And I just kept going and figured there was 5 or 10 more years, and then I could think about dialysis and transplant or whatever the alternatives were. Unfortunately, by December of 2007, is that right? No, okay, I got it wrong. I'm sorry for that. It doesn't matter what year, but December of 2006, I was told that my function had dropped down into the 20s, and then by April of last year, I was informed that I was down to 15%, and it was time to either find a kidney or prepare to go on dialysis this year. Now, dialysis is a wonderful invention and saves many lives and helps many people in all kinds of ways. The problem was that I also learned or relearned that my blood type was B positive. And with a B positive blood type, the prediction was 12-year average wait for a cadaver kidney on dialysis. I didn't want to face 12 years on dialysis. I want to put in a mention here for the Canadian healthcare system because I'd moved my career, become uninsurable forevermore in the U.S. But as a permanent resident of Canada, accessible, equal, quality health care is available to everyone. So at least I wasn't thinking about my insurance and my life savings and my house and my children's future and those sorts of topics. But there was a lot to think about. How does one go and find a kidney? Well, I'm grateful to the modern times and social technology networking possibilities. One click of the email, and hundreds of friends and colleagues learned about my situation and circumstance. And I very politely, as a good Southerner, said, of course, no pressure, but could I have your kidney? And in July of last year, an old and dear friend of mine named Siobhan Robinson, who's sitting here in front of me, called me and said that she had made it through all the tests and had been chosen as the most qualified kidney donor for me. And that she was thrilled for the opportunity. Now, it pales in comparison to what you've just had to think about in previous talk, but think for a moment and consider for a moment, imagine what it's like when someone says, I will give you my kidney. So on we go to November 14th of last year, the 18th anniversary of Siobhan's breast cancer surgery, successful, to the day. And the good news is we had a super successful experience, both of us. We recovered quickly. My anti-rejection drugs have minimal side effects on me, only to add to my nervousness, sometimes a little anxiety, but minimal impact. I've been able to return not only to my full workload and passions, but I can see better, I can hear better, I can think better, I have more energy, and I feel better in every way, shape, or form. Well, that's one of the good things about what the healthcare system can do for those of us lucky enough to either be wealthy or live in a country that provides it. And I want to repeat that in Canada, equality, accessibility, and quality are just a given to Canadians. Now, it's true that, as my employer does, there are insurance bump-ups that one can do to increase coverage. Some of that's for private rooms, but in my case, it does cover 100% of my drug costs, which is pretty good since there's up to $1,000 a month of drugs for me forevermore. But without extra insurance, I was covered for 10 years in a prevention clinic. A very visionary woman doctor in Vancouver persuaded the government she could save money by doing prevention work on kidney disease. In any case, 10 years of care there, a kidney transplant surgery, care for the rest of my life, drugs, blood tests monthly for the rest of my life. I was never asked for money. I was never asked for a credit card. I never negotiated with an insurance company, and my family and my friends were able to focus on love and support, which I believe most of you would share is a very important part of the healing process. Now I'm back trying to see what, oh, by the way, any of you who know me would expect me on the next panel on money, not health. I'm no expert on healthcare policy, but I am a strong believer in the interconnectedness of all things in a systems approach. And I've chosen to put my work where money is, and I'm speaking momentarily to those of you here who have the incredible privilege to own and control money, and say that applying capital towards systemic approach to problem solving, to connecting alliances, doing leadership development and capacity building, and creating circumstances like this one here at Momentum where issues can cross. You came up at 3, but I got 6. Yeah, okay. Nice clock here. Is something that needs to be done. There's a massive amount of sleeping and distracted capital, probably even some sitting here in the room among us. We have to break out of the cycle that tells us that holding on and building infinite wealth is a responsible and moral position in the world. And those of us, whether we're individuals, or a nation, we have got to apply our wealth towards looking after the people and the planet that are here today and towards future generations. We're doing things like the Tides Renewal Center in Vancouver, which is a co-location model inspired by Tides' work here with the Thoreau Center for Sustainability. 30,000 feet of Canada's first LEED-certified leasable office space that will house some wonderful social entrepreneur organizations in the Delta sector and in the money-making sector. We're launching a social venture investment fund called Renewal 2 that builds on our 15 years of making investments that are attempting to support those who are creating solutions, particularly in underrepresented sectors of the economy that don't have massive venture capital and money behind them. That's going to welcome investors and make investments all over this continent, and it also is available to charitable foundations who want to do mission-based investing. I have a little green, you can only see a little green dot here. This is a political button for one of my best friends, whose name is Gregor Robertson, who as an entrepreneur built a very successful company in Canada called Happy Planet, which provides organic foods and juices across Canada on a deeply systemically thoughtful rationale of the impact of the business. Gregor decided that he had to have more impact and he would try that through politics. And in a stunning victory recently in what was a people's and new media type campaign, especially for Canada, the largest number of members ever for a municipal party in Canada, at least I understand that to be correct, Stephen, came out to join a new center-left party called Vision Vancouver and nominate Gregor to run for mayor of Vancouver on a social and environmental sustainability platform. Gregor was also a founding board member of Tides in Canada. Another one of our initiatives is to build a substantive national public charity that can support a full range of social and environmental and other progressive issues in Canada. It was in the face of overwhelming global and human problems. Maybe this experience for me is analogous to get up here and talk right now. of what I felt as a young man when I was diagnosed with what may have been a death sentence, which I took as a life instruction message. Whatever resources we all have, we have a responsibility and an obligation to put them to work now, not tomorrow, but now, for the things that we believe in and care about. We need national health care in this country. Think about the impact on the psyche of humans in a nation. And everyone before me has laid this out, but who have to worry about whether they can keep their home, whether they can whether they can care for what's wrong with them. Think about the economic impact of having employees who know that they can get health care rather than fear and not go to their appointments because they're worried about money. We need national health care. And when you hear about all the horrible things about the Canadian system, some of them are correct. There are long wait times sometimes for people with non-life-threatening and elective challenges, and they suffer from that mentally. There are, my hospital and many of the medical facilities could use an upgrade. There are a number of things that are imperfect in this system. But when you hear how bad it is, be sure and think twice and take another look. It's crucial that people, particularly in the wealthiest nation in the world, can feel safe about their and their family's health. So thank you for hearing my story.